Okay, I think it's about time that we got started. So again, welcome to the webinar on NHS Green Travel Plans. My name is Mark Hand. I'm the Group Business Development Director for Mobilityways, which is part of the LiftShare Group. And I'm joined today by, first of all, Barry Waterhouse, who's Group Travel and Access Manager at the Northern Care Alliance. I've worked now with Barry for about 6 months. A pleasure to work with, hugely knowledgeable, and although we're both very aware of how serious the work is that we're doing, he's always up for a laugh, which makes the work with the Northern Care Alliance really good and good fun. You'll also, the eagle-eyed amongst you will notice that David isn't here. David's been called away at the last minute and has asked his assistant transport and travel manager, who is Elaine, to join us, Elaine Young. And thank you, Elaine, for stepping in at very late notice. I know this would not be fun for you with not a lot of notice. But Elaine also comes with a wealth of knowledge. She's worked with David for more than a decade. And actually, privately, we think she knows more than David does. So I think we'll learn an awful lot from Elaine this morning. So my role today really is to provide you with some context to the two main presentations that will come from Elaine and David. And if we could just move on to the next slide, please. So for those of you that don't know us, I'll just provide a brief explanation. So LiftShare Group is a social enterprise that's been around for over 20 years now, primarily focused on reducing single occupancy vehicle journeys to large places of employment. Just before lockdown, we took our billionth mile off the UK road network, and we were on a trajectory to repeat that every 3 years. So things were very exciting. Of course, that changed with the pandemic. A number of things have changed from the pandemic. And as a result of that, we took a step back and given the circumstances and given the need to address climate change, we considered how best we could add value as an organisation to that challenge. So we created a brand which enabled us to look more broadly at sustainable travel, but with a laser focus on the reduction and ultimately the elimination of commuting emissions. And that's what Mobilityways is all about and what we're focusing on. So our ambition is to achieve zero carbon commuting in the UK as a minimum by 2040. We launched this earlier this year, and I'm delighted to say we're already working with dozens of very large employers, including a number of trusts, many of whom have asked us to be more ambitious and to help them to achieve that goal by 2030. Next slide, please. So just to give you some wider context as to why this is the right time to take action, beyond the obvious, which is the net zero targets that we have as a country and that the NHS has as an organisation. It was very interesting when the United Nations did a global survey back in January. They asked one question around the world of 1.2 million people: is climate change a global emergency? And the response around the world was a positive figure of about 64%. The response in the UK was 84%, which was the largest figure on the planet. That's been reinforced more recently by the Ipsos Mori poll that shows that 85% of us are concerned about climate change, with over half being very concerned. And more recently, government figures showing that in terms of top 3 concerns of the UK population, climate and the environment now sits in the top 3 consistently. We also know that about half of the population, again according to polls, want to do something about climate change, but are not quite sure what to do. So in terms of our role and the role of others speaking to you today, this is really about finding a way to enable employees, and in this case NHS employees, to make a difference quickly through changing the way in which they commute. Next slide, please. The timing's also right because the government have now recognised that the commute needs addressing in its own right. With transport being the biggest emitter in the UK of carbon emissions and the commute being the worst offender, they recognise that we have to address commute emissions or we're not going to hit our net zero targets. So they've come up with something called Commute Zero, which is a focus in on helping employees or helping employers to help their employees to reduce their emissions. And next slide, please. But they want to go further than that. They want to make sure that large employers in both public and private sectors are measuring and reporting on their commuting emissions, both at a total and average level. And they flagged one of the tools that we've created as one which enables that to happen in a way which is not onerous. They've also focused very clearly on the need to increase vehicle occupancy. And as an example, in terms of cars, we've got a current level of occupancy of about 1.2 per vehicle. If that were to increase by 10%, it would remove the same level of emissions from the UK as the entire bus network. Equally, we need to be upping the occupancy of those buses that serve us so well. But if they are running around with 8 people on them, they are doing no better for the environment than somebody driving a petrol car alone to work. And next slide, please. So what we've done is come up with a framework, and I'm going to just cover this very quickly because it will provide you with context and background to the two speakers that will follow me. So we've come up with a framework, but if you remove the word framework, you could put in the word dashboard, because everything that we can do that's on this slide can be measured, reported, and looked at within a single dashboard that can be provided for you as an organisation. And it works really in 2 halves. If you look at the right-hand side, we've got 3 component parts, and we start with the one in the middle, which is a focus on how people are actually commuting. And that's a straightforward travel survey, and that functionality has been produced so you can do that simply and understand the percentages of staff that are traveling in certain ways. And that's important because using the ACEL tool that we've created, we are able to convert that data into understanding the average emissions produced by every single employee who's commuting, expressed in kilograms of CO2e. And because we've mapped this for the entire country, it means that you can compare how you're doing with others in the country, with others locally, and as this gets more embedded, with others within the NHS. So the travel survey and ACEL together provide you a benchmark, a starting point of where you are and what current behaviour is. Moving up to the top right, the scoping enables us to grab anonymous postcodes of staff and to very quickly understand how people could travel as opposed to how they do. It will show us what the impact of change might be in terms of reduced CO2e, nitrogen, health and wellbeing implications, cash savings for staff. And it will also show very clearly where the gaps in provision are, where we've got large clusters of staff who have no other option but to travel alone, often in a petrol or diesel car at the moment. Because that data becomes very powerful if we can then start to share that with third parties such as transport providers and local authorities in terms of starting to mitigate some of those shortfalls and give people more choice. As we move then to the other side of the circle, into the bottom left, this is where we convert that information to a level which is very much for the individual. By enabling staff to go and download a personal travel plan in 20 seconds, as frequently, as often as they wish, giving them all of their choices and showing them the impact of their decisions. There's then a period in which we need to engage with staff. We need to understand why, if 5% currently cycle but 30% could, what are the barriers? What incentives do we need to overcome those barriers and to actually change behaviour? And constantly analysing and reviewing the campaigns so we understand what's working and what isn't working before we start the whole process again. And we start again because if, as a trust, you've started to put in new measures and make new things available for staff in terms of modes of travel, whether that be car sharing or e-bikes or e-scooters or car clubs, or many of the other myriad of new opportunities that are coming through. If we put some of those things in place, there's more opportunity that will be picked up in the scoping. And if that's the case, travel behaviour will start to change, and we'll see that through the travel surveys. And if that happens, the ACEL, the amount of emissions per commuter on average, will start to decline. So I hope that gives you a good context, and then just moving on, please. So just finally, within an NHS context, I'm sure many of you are aware of these figures, but just to reinforce them, Commuting makes up 4% of all the emissions in the NHS, and it's only slightly lower than water and waste, which has seen a huge amount, quite rightly, of effort and time invested to make sure that those emissions are reduced. We need to see the same effort and time put into commuting to make sure that that's addressed. And what we're trying to do here is to help you with the annual planning and reporting that you need to do, and the targeted interventions that you need to demonstrate to make that, again, as light touch as possible for you whilst achieving some really good results. And I think the quotes at the bottom from Sir Simon Stevens explaining why this is so important in terms of the NHS and its role in our net zero targets, and Dr. Nick Watts showing nearly every member of staff within the NHS thinks the NHS needs to be more sustainable, is very encouraging, and obviously a key reason why we're focusing so strongly on this as a sector. Next slide, please. Okay, I'll hand over to Elaine, and thank you for listening.
Hello there. Okay, well, I'm here today to talk about our Green Travel Plan and how we have and continue to sustainably integrate our transport. So, as introduced previously, my name's Elaine Young. I'm the Assistant Transport and Travel Advisor of Newcastle Hospitals. Here today, taking the place of David Malone, who fortunately couldn't make it, so would like to extend his apologies. This is David's presentation, so you may have to slightly bear with me, but we'll see how we go. Okay, next slide, please. Okay, so we thought it would be helpful to give you a brief background of our travel planning journey. In 2004, David was appointed as the Trust's first Green Transport Coordinator. He was primarily tasked with delivering the Trust travel plan. That was part of a planning consent application made to the Council, renew build on both the Freeman and RVI site. The primary aim was to reduce single car occupancy travel by looking at alternative measures, namely public transport and cycling. So just to be clear, this was a planning requirement. We desperately needed to reduce traffic in and out of the hospitals as well as the surrounding area. Prior to David's appointment, all car parks in the Trust were managed by an overarching operations manager. There was the sole focus there was traffic management, no focus at all on carbon management or reduction. At that particular time, there was no baseline survey data to speak of, and so, certainly no budget. Next slide, please. Okay, so we can look at what we immediately did. In the beginning, there was a flurry of new initiatives, most namely the travel scheme that provided discounted season tickets for staff. There was the Bike to Work scheme, which allowed staff to purchase their cycle via salary sacrifice, so they would make considerable savings and also have the benefit of purchasing a cycle over a 12-month period. So the uptake of that was considerable and continues to do so. There also was the Hopper service, which probably was the most high profile and successful initiative at that side. That allowed staff to quickly and efficiently travel from site to site. It was a real game changer in terms of staff moving around site for meetings, etc. There also was, with respect to the lease cost scheme, a cap on emissions. So it kind of gently steered staff towards making greener choices when they chose their departmental pool vehicles, for example. So looking at the weaknesses that were immediately identified at the time, car parking charges at that time were considerably cheaper than public transport costs. We were also dealing with a quite rigid and restrictive car parking policy. The policy tended to steer towards want rather than need, and also, for example, job title was used when assessing an application. So you could, at the time, have a situation of a senior sister who lived 1 or 2 miles away from the main hospital being deemed eligible for a permit, over a colleague who maybe lived 15 miles away who was deemed ineligible. So there was a discrepancy in fairness there that also needs to be addressed. There was also no funding, which you'll see is a recurring theme through this presentation. So looking at opportunities that were immediately identified, well, we could certainly dive in and try and align those prices to public transport. We could certainly look at the permits that we had and try and ensure that they were as flexible as possible. Car sharing is something that we certainly need to look at and certainly need to address. And also evaluation of needs. So that's going back to my point made before. We just need to ensure that car parking permits are issued on a basis of need, not want. And probably most important is we knew we had the opportunity to really engage with staff with respect to their travel behaviour, be it road shows, be it just constant staff engagement, collaboration with our human resources department. So we knew that we needed to bring staff along with the journey with us. So in terms of perceived threats or, the problems involved with all of this, well, to be honest then, and probably still now, NHS parking is a hugely contentious issue. Any notion of raising parking prices is generally roundly pushed back against our unions, externally generally roundly condemned by our press and MPs. We've always needed to keep an eye, particularly at the moment, on recruitment and retention. We do find that there's often an expectation with new staff that a new job comes along with a car parking space. That's obviously not the case. That would create incredible pressure on our car parking areas, and it can be a difficult conversation to have with staff when that car parking space isn't available. So we need to work hard with our human resources department then, and obviously travel behaviour in terms of ensuring that staff are on board with what we're trying to do. Okay, next slide please. Okay, so looking at car parking and what we did do well, we did manage to align those prices with public transport. We did negotiate a price rise from £16 per month to £40. That was for a full-time permit, obviously pro-rated in terms of part-time working. So that was an increase from 80p to £2 per shift. We managed to merge all of the smaller departments into one overarching transport team. So that created a much more streamlined approach and stopped any interdepartmental conflict. And I think probably the main thing that we did is that we just stopped saying no in terms of a car parking application. Of course, we may not be able to give the staff member exactly what they've applied for, but what we do go back with is a personalised travel plan, or manual at the moment, with a plethora of ideas of what they could do, be it park and ride, be it a different type of permit that they've originally thought of, a much more flexible approach to their journey to work. We always try and push the cycling agenda with maps and, have you thought of this? So we do try and have a much more holistic approach in our responses to staff. But we do appreciate that we need to improve. We need to absolutely maintain those links between parking charges and public transport rates. We know it's actually absolutely key to someone making that decision how they're going to travel into work. We need to ensure that we continue to keep our eye on the ball with respect to what we're offering permit-wise, ensuring our permits are flexible, ensuring that we offer ad hoc permits, for example, staff, for example, we offered recently an ad hoc type of permit where staff could come into work 40 times a year rather than every day, and that's been widely successful. Going back to car sharing, that's been something that we haven't quite been able to crack. I know that David often jokes that, we're seen as a friendly region, but we haven't been able to get people to share a car to come into work. But that's always on the table and something that we're really trying to achieve. And also going back to the evaluation of need over want. So this is something that we need to continually strive towards. Okay, next slide, please. Okay, so this is an interesting overview, a good snapshot of where we were and where we are in terms of single car occupancy. So if you can cast your eye to the bottom bar, please, which takes us back to 2004, where we had 50% of staff who were travelling into work alone in their vehicle. You can see that there's an immediate decrease as the green transport agenda starts, and then as we start balancing out our cost, creating good measures, the decrease continues, and then when we're completely in full swing, you can see that we're at 27%, which is a really great place to be in. You can see in 2019 a slow creep up. I know that was linked with public transport costs increasing, but still with an organisation of 16,000 staff, that still equates to 2/3 of our staff not travelling to work alone in a vehicle. So that was still quite a good place to be in. But then it takes us up to 2020, and unfortunately the COVID-19 situation. So obviously we needed to get our staff into work safely. Public transport services decreased. Also our staff, many of which didn't feel safe using, so they needed to come to work in their vehicle. Obviously free parking was introduced, and all of that together brings us back up in 2021 to 52%. So we are more or less back to where we started. Next slide, please. Okay, so we can just talk about the climate emergency declaration. We were the first healthcare organisation in the world to declare a climate emergency, going for 2030. We know that our City Council and Newcastle University, our neighbours, have also declared, so that's a nice collaborative state to be in. Obviously 8 years, so that's quite a challenge. It's also quite a challenge is that we are also negotiating the NHS parking manifesto. The manifesto outlines parking provision, most of it free, for some patient visitor groups and also some staff groups. So it feels quite counterintuitive in some ways, is that we have 8 years with respect to our target, but we are having to implement more free parking situations. So that is a challenge, of course. COVID-19 has created a completely new landscape in respect to care, a huge backlog of care needs. You know, hopefully patients whose operations, etc., have been put on the back burner are now able to come in and get that care that they need. But that creates more pressure in terms of our patients coming onto site. There's obviously, of course, the government's pledge of more hospital build and infrastructure. And along with hospital build comes car parks and more staff requiring to get into work. So looking at that as a whole, it is quite a challenge in this 8 year moving forward. And next slide, please. Okay, so how do we achieve this? Well, what we do know is obviously that the travel plan and alignment and integration of the car parking strategy is more important than ever before. The key to all of this, and obviously is what we've touched on previously, is that we absolutely need to reduce unnecessary travel. Parking must be a need and not a want. But in order to do that and to engage with our staff with this ethos, we need to understand the gaps in access. We need to ensure that our staff nurses can get in on public transport to start their 6 AM shift in the morning. We need to ensure that there's safe, available public transport to get them home later on in the evening. And we also need to know where there's gaps in our cycling infrastructure. If staff want to cycle, we need to ensure that we're supporting them, that they have the knowledge and the confidence of local cycling routes. So that's something that we really need to work towards. We need to electrify our fleet, something that we're working very, very hard to do. Our contracted courier provider, I believe, is on electric vehicle number 7. So that's great achievements in about 12 months. And we need to obviously invest in all of this. So the Trust Financial Director is very keen that this is a collaborative approach. Obviously, all of this takes funding, and there isn't a great deal of it within the NHS. So a collaborative approach with respect to funding with our partners, most namely the City Council, is something that we can hope to achieve. We also need to work really hard with our human resources and have clinical engagement, just to ensure, touching on the recruitment and retention point again, that staff who hope to come and work with the trust are given a package in terms of a push towards greener measures to get into work, rather than that car parking application which they would have been given a number of years ago. Okay, next slide please. Okay, so we need progress and we need it fast. Obviously, the slide here is touching on things that we've talked about: the unnecessary travelling, the investment in EV installation and cycling. One thing that we haven't touched on as yet is procurement and deliveries. There's been talk for many years with respect to developing a single delivery point within the trust, just to reduce those outward deliveries. So we really need to, that's something that's been talked about a lot. At the start of the pandemic, we were tasked with setting up a transport courier hub that was to reduce footfall in the trust. And by that, it was delivering medication to patients' homes. We're currently delivering about 5.5 bits of medication a month. And the point I make there is that that was something that was talked about in the trust for many, many years, but was seen to be such a huge undertaking that we never quite got there. But as the pandemic started, this particular venture was set up, I believe, in about 3 weeks. So I think it's something that we know that if we know we need to do it, that it's something that we can do. So I know that the procurement and delivery side of things, that's something that we're trying to look at now. Okay, next slide, please. Okay, so I think that we are absolutely better placed to flip that graph of travel change from 2004. We know that we have the infrastructure, we know that we have some software to help this, but we are just on the cusp of using Mobilityways, which I know is taking quite some time to get into place, but I believe it's very close, because we know that we need to survey more frequently. We know we need to capture carbon data, and we know personalised travel plans are absolutely key to this whole venture with respect to giving staff the information and knowledge that they need to make better choices with respect to travelling to work. Presently, all of these things are done manually within a very small team within the wider transport organisation. So we're very much looking forward to Mobilityways being on board. But we know they're supporting policy and a climate change agenda, so we feel that we're not alone in all of this. We know there's a national drive from government, and we absolutely know there's a greater awareness from staff. We do feel that we are often taken to task by staff. They want to work for an organisation who achieves this by 2030. They want to work for an organisation that's working, making greener choices. So we do feel that staff are on board with us for this entire venture. Okay, next slide, please. Okay, so in summary, we know that not only is this something that we need, we know that this is something that we absolutely want to do. We know that we have great staff engagement that we're continuing to make better. We know that we have some great measures in place, some exciting new ventures just around the corner. So we feel that we are in quite a good place to get where we want to be. So if anyone is interested in looking at our climate emergency declaration, the YouTube link, is included in this presentation. So I think that's about it for me. So thank you very much for listening.
Elaine, thank you so much for that. That was brilliant. I wish I could be as fluent with seeing a deck 10 minutes before I was presenting it. So thank you very much, and a tremendous amount of information in there, which I found really useful. And I can tell that the audience are engaged, because we've had lots of questions in, which we'll come to at the end. Just a reminder on the questions, if you could please put them into the Q&A and not the chat. Just say who they're for, and we'll get through as many as we can in the webinar, but we will answer every single question. So if you've got specifics for Elaine that we can't quite cover in the time, for example, Elaine will come back to you with answers as we will. Okay, we're going to have just a short moment while you're sort of absorbing that and also maybe writing down any more questions, and just give you a quick break with this video.
Right now, it's super convenient to drive around big cities like Auckland or Christchurch, so of course people don't want to give it up. But here's the thing, it is not a coincidence that it is convenient to drive. We literally built our cities for cars. We used to think they were the best thing since sliced bread. They went really fast and took you exactly where you wanted to go, and as far as we knew, they weren't bringing about any catastrophic weather disasters. So we built all our houses really far apart and got rid of trams and plonked in big motorways and made cars the best way to get around. It's like if everyone was super into stilts when you built your house. Your front door would be 13 feet tall and all of your shelves would be super high up. Thank God for stilts, you might start saying. Otherwise, how would I open my door and reach all my shelves? Well, now imagine that we found out that stilts were the main cause of a global climate catastrophe somehow. I haven't figured out that part of the metaphor yet. So everyone had to stop using them. Yeah, you probably wish you didn't build your house like that. It's going to be pretty annoying walking around without stilts now because the door is so tall and you can't reach your stove without a ladder. Well, that's pretty much what happened. Right now, we're all stranded in this weird car city. And now, unfortunately, we have to stop using cars so much. We're in the process of lowering the shelves, and eventually most of the doors will be human-sized, and it'll just make sense to take the stilts off because wearing stilts will be annoying and you'll look like an idiot.
So we'll just hand over to Barry after that one.
Good morning, everybody. Thank you very much for listening to me for a short while. We put that in just as a little bit of video of a stilts metaphor. We are actually seriously at the Northern Care Alliance thinking about using that video to perhaps try and explain a little bit of why we can't keep going on with people using a car. We're still working on it at the moment and we're still developing how we do it, but we just put that in. It actually comes from a cycling thing in Auckland where there were some issues with cyclists, but we are thinking of using that stilts metaphor to try and explain to some people within our organisation of why we've got to try and move away from the car. What I was going to do is, I think the presentation that Elaine's just given us, I think it resonates, and there's a lot of detail in the stuff we're doing for us as an organisation that I can really relate to, and the information from there. What I was going to do is just do a quick presentation. We've been using Mobilityways for around 6 months, so it's just a little bit of an update and an information of where we're up to. And how we're using it and how we see the future developing for us. I'll be honest that our approach to sustainable travel and active travel and encouraging staff to commute differently, it is a little bit more scattergun than Elaine and David at Newcastle, but then that's part of our experience. So a little bit about the Northern Care Alliance and where we are. Just the slide up there, we're about 19,500 staff, 4 hospital sites. You will see on the map there, that's our 4 care organisations where our hospital sites are. For those of you who don't know the geography, the little blob that you can see, the little blank blob in the middle, is actually the city of Manchester. So in terms of travel and promoting active and sustainable travel, that gives us a lot of opportunities, but it also creates a lot of issues for us in that we're around the edge of Greater Manchester, and a lot of our journeys require us to disappear into that blob to come back out again. So that's the size of an organisation that we are. We've 2 trusts that have merged together. So we're trying to come under the umbrella of a new NCA family and develop our processes and structure now as we move into the future. Next slide, please. So we spoke with Mark and the Mobilityways, and we looked at the partnership offering that was available. And when we set together the case that was approved within the Northern Care Alliance for how we were going to work with Mobilityways, we divided it up, and I've split it into these 4 sectional headings, which I'll go through in the slides following. The idea was that we saw these as the positive benefits that we could develop, and how we were going to use the data that Mobilityways could provide us to assist us with all the work that we were doing in terms of delivering a net zero national health service, decarbonising transport, and obviously supporting our active sustainable travel and our health and well-being of our staff. So what I'll do is go through each of these four in the next few slides, just a little bit of information about what we've been doing so far, and then some insight into the information that we've already been getting from Mobilityways. Next slide, please. So in terms of consistency, data and impact, with going into partnership with Mobilityways, we saw it as being an opportunity for us to have a standard method of reporting and reviewing our information. The other positive for us was that we had the ACEL, which we'll go into a little bit later, which meant we could monitor that. It was a national measure that we were able to compare ourselves with. When we initially spoke to Mobilityways, this aspect was new for us. We looked to set up partnership with them as a 5-year process, rather than picked our usual approach is to tend to try something for 12 months, see how it develops, and then decide if we're going to continue with it. We made a conscious decision to not do that, to give it an extended period, to give us the opportunity to work with Mobilityways, to integrate it into our processes, but also to actually give it a period to deliver and see if it was performing before we made the decision to then continue or develop further. The other issues that we had is that our data collection, hand on heart, our travel surveys, I had a previous director or a previous manager who basically every time we needed to do a travel survey went, why do we need to do that? And was very reluctant to spend upon travel surveys. So we have an issue. We've got some sites, because we're a combination of two NHS trusts. Historically, we'd had very good travel survey information at one site. We have no data at all on some of our other sites because it was left very much piecemeal. So the idea with Mobilityways is we'd have an improved data collection. It would all be in one place and it would be consistent. We'd have everything consistent across the group. The other aspect that we were looking at, and we did as part of the sell in our business case, was impact. As we've come on to in a little while, we've got the scoping reports and the scoping analysis. We've undertaken that as the first step of our Mobilityways project. We have scoping analysis reports now for 14 work locations, because we have our 4 hospital sites and locations that we have within the wider Greater Manchester community. And we've used those scoping analysis reports to basically give us an idea of what is possible and the simple points. The idea for that and for the progression of our zero commutes and trying to encourage travel plans for our care organisations is we will provide that scoping analysis as saying this is possible. How do we now look to deliver that at our care organisations? Next slide, please. So, as I've just mentioned, the scoping smart mobility analysis, it is that report. There's just some screenshots there, they're a little bit difficult to see, but those are the actual pages from the scoping analysis. So for each of those hospital sites, as we provided the data for each of those work locations, we have the information of what's possible, and it's in a simplified form. It gives us percentages, numbers, what our carbon savings will be from the impact of that. It's a basic analysis. It's just taking postcodes and looking at a theoretical journey, so we know that it's not completely achievable, but it's actually telling us for the first time what the mobility team was, that it was telling us stuff that we already thought and that we'd already discussed with partners about how we change our state. It's actually confirming it in the data, and as it's put in there, the quote, it's the art of the possible. Next slide, please. So this is just an example from the report that was produced for our Salford Royal Hospital.
Okay, I think we've just Barry,
that is the map. We solve various mapping options with the information and the data that we have there.
sorry, we're getting a little bit of cutting in and out. Just
Okay.
keep trying for a second.
Right. Is that better now?
Yeah, keep going.
Right. So it may well be my laptop, a little bit temperamental at them today anyway. So the slide you can see there is the active travel mapping for our Salford Royal Hospital. So the information there, the percentages are there that theoretically it identified that 57% of our staff working at that site, commuting to that site, could walk or cycle. And they're within that little orange area that you can see, the orange and green within that area. 71% of those would have achieved their daily exercise recommendation. And also just generally for staff, that 100% of the staff postcode information that we supplied did have a sustainable alternative. Some of them may not be theoretically possible, but there was something there, and that tied in with some of the other work which I'll come on to, which we've already been doing in relation to travel behaviour change. But it told us that there was actually a possibility where those in the green area could possibly walk or cycle, those within the orange area could cycle. So we knew, this is our opening conversation with our care organisations, we think that on any given day we could lose around half of the parking capacity need. Next slide, please. The other aspect in terms of the mapping is public transport. So again, just some of the percentages from there. The green that you can see obviously is where it's perfectly possible with a number of transport changes. As you can see, obviously with public transport network, the percentage of people that have an option that's quicker than driving is quite low. But that's the nature of the network. Public transport travel is going to be slower. It's some of the nature of the network that we have in Greater Manchester. The information, we also have that data split by operator. So you'll see there that Go Northwest provide 3,400 of our employees at Salford Royal a possible commuting or viable commuting option. So we're using that scoping analysis data to then have conversations with transport operators and transport authorities for then how we can put measures and interventions into place. Next slide, please. Then we've got the lift share, which is the car sharing. Again, a large majority of our staff, which surprised us, it was greater than we expected, have a lift share match. We're now working on that, obviously, with Mobilityways for how we develop that further. We're the same as a lot of other organisations in that car sharing has always shown great potential, but has never fully taken off for us. But part of our conversation and our further work now is how do we make that take off, because we now know from those percentages that it really is achievable. Next slide, please. So the next aspects that we're looking at, some of the things that I've already referred to with looking at the scoping analysis, is we were looking at to complement some of the work that we've already been doing and some of the partnerships that we've already got in place to revise our travel plans and deliver this net zero commuting. So we already have some group tools, support, and some activities that we've taken place. Some of them, as I mentioned, have been a little bit scattergun. The examples that we've got there, the photo there, the first one on the left-hand side there is our mural that's in the Mayo building at Salford Royal Hospital. We worked on a marketing campaign which was 1 day a week, where we said about the percentages, the idea is we try and encourage staff at least 1 day a week or 1 day a month to change their travel behaviour. So we'd done this previously. We worked with a consultancy, the Masodi Transport Consultancy, to do that for us. We put a big mural. There is a reason why we picked a mural. Salford is obviously the home of Coronation Street. Ilda Ogden, if anybody is an avid watcher of the show, always had a mural on the front room wall. That is our equivalent of Ilda Ogden's mural. We put that up in the cafe in the Mayo building on the basis that all our staff training, and we noticed most of their selfies when they're on training sessions, were taken against that wall. And every one of our directors for our group tend to come down there to get their sandwiches in between meetings. because they are based in the Mayo building. So there was a reason for that, and it was a positive. The other things that we've done during COVID, we've worked with a local bike hire company, Manchester Bike Hire, to deliver e-bike hire, and we're expanding that to other bike hire. We've actually meant it so that our staff can try an e-bike for a month period rent-free. Then they can either choose to rent it or do. It's all this support. We've also looking at our bike facilities. Traditionally, we've had very poor bike facilities within the group at each of the care organisations. So we're looking at a standard specification for how we can improve that. And we'd already started to do that work, but Mobilityways now is helping us direct and give better interventions, better conversations with partners and stakeholders, and we've got the mapping to highlight the detail. We're then developing that further, because then within Mobilityways we get the travel surveys and the ASL calculations to refine. Next slide, please. So just a quick snapshot, the Mobilityways travel survey. I've said historically we've been very bad at travel surveys at certain sites. So the idea is we bring them all together in a standard format, we collect the information. The other thing that is appealing to us is we can look at more targeted surveys and get some real deeper information and insight and collect some data, which again we can then use back in our interventions and improving our package that we're offering to our staff. Next slide, please. ASL, as I mentioned, average commuter emissions level. As soon as we've completed our travel surveys, we haven't got that yet, but as soon as we start our travel surveys, we will start to collect the data on that ASL score. We've already got an example of how we think we can improve it from the scoping exercise, but then it's just moving on from there. Next slide, please. And again, it's health, well-being and supporting staff. As Elaine mentioned, it's these conversations, working with our human resources team and our staff engagement, but we also launched straight away the MyPTP travel plan package to help staff plan their commutes. And also to gradually increase within our organisation, almost a travel hierarchy. So we're encouraging them to make those sustainable and active travel choices, and giving them all the help and the support that they need with the measures to continue away from that. And the little bit there is ideally, but we don't want to do it directly, because as Elaine mentioned, we tend to work in parking. We get the thing of people being the people who say no. We want to try and gently guide people away from the bad choices and link it into our staff health and wellbeing program, our staff program, so that they feel it's part of the full package. Next slide, please. Again, personal travel plans. MyPTP, we dictate the information that goes into that contact that the member of staff makes. So we've introduced that, and we've encouraged our staff to get that personalised travel plan, and then we put as much information and support as we can into that message. We've also sought to do that. We're revising, because luckily my role covers parking and sustainable travel. We've looked to try and package that up into the message. So where we're rolling out a new parking application system at our Rochdale site, beforehand we've put the MyPTP widget onto the website and encourage people to use that prior. What we found with that so far, although it's only anecdotal, we can't fully quantify it at the moment, is around 250 staff have taken the option of personalised travel plans. 100 of those have then, from the information that's supplied, have not then gone on. So there's about 100 of those that we can line up with our parking application system, but they've not applied for a parking permit after they've had the MyPTP journey plan information. So we're hopeful, we've got further analysis to do, but we're hopeful that by putting that at the front end, we're already encouraging staff to not make that parking application or make some change to their travel behaviour. Next slide, please. So the last one was Trailblazers in terms of what we were looking to do in the business case. Yes, we were looking to work with Mobilityways as an early start on this, and we're very keen to work in partnership. It's what we can both bring to the partnership. But throughout within our travel, we know that Mobilityways is not the only aspect to the measures that we have to look to introduce. We've created already with our previous partners, Masodi in Manchester Bike Hire, Transport for Greater Manchester, Love to Ride in Manchester. It's creating an honest, open partnership, and we share our expertise and ideas. Mark's second slide when he opened up the talk was basically a house on fire. For our analogy, we saw Mobilityways as helping us and being the fire engine that is delivering our firefighters to the right spot to fight the blaze. So it isn't a be-all and a total solution to what we're looking to do, but it is part of the package, and it's part of that honest, open partnership that we're doing to help deliver what we need to do. Thank you very much for that. I've very quickly gone through because I've noticed the clock was ticking down on everything from there, but let's see if there's any further questions from there, Mark.
Barry, thank you. That was brilliant. And if we've achieved nothing else today, we've introduced some fantastic metaphors for everyone. We've had lots of questions. If I could just ask Elaine, if you could put your camera on as well, please, Elaine. We've got about 5 or 6 minutes for questions. As I mentioned before, anything we can't cover now, we will respond fully. And so if you've still got any questions, please do put them into the Q&A section and we will come back to you. I'll pick up a couple really quickly, and then I've tried to theme some of these as well, scribbling in the background as Barry was speaking. Elaine, just a quick one for you first of all. Do you undertake annual travel surveys to measure single occupancy vehicle levels?
No. No, we don't. No, we don't. I mean, we do, obviously, the travel survey. We don't do an annual survey. It's something that we always aim to work towards, but it's one of the reasons that there's been this huge push to get on board with Mobilityways, in terms of it's going back to that smaller team within a bigger organisation. So we do the travel survey, but it would be disingenuous of me to say that it was an annual thing, because we don't. But the hope is, as we move forward, it will get to that annual status, because we know that's where we need to be.
Brilliant, thank you. And the next one was asking about your manual PTPs. Are they onerous, essentially? I think you probably picked that up in terms of part of what Mobilityways offers is that becomes automated, and that you can actually track that.
Without a shadow of a doubt, at the moment, they are completely manual. They are incredibly onerous. It is very dependent on an individual's knowledge of the area and the public transport providers. So if Mr. Malone was on the call, you know, he would do a travel plan in 5-10 minutes, but someone new to the team, you're starting from fresh. It's an incredibly difficult process, because you need to get it right. You can't, you know, worsen an argument or a situation by giving someone a PTP that they come back, well, actually, that's wrong. And we have been there, and it makes a really difficult conversation, you know. So, yeah, a manual PTP, when you're doing about 50 in a week, it's not a good place to be with a small team. Absolutely.
Thank you very much. There's a question on data, which didn't surprise me. So I think if we tackle this maybe in a couple of ways, in terms of scoping and postcodes, I'll say a couple of things and then pass over to Barry. We've now undertaken scoping for 600,000 people. We've done that with dozens and dozens and dozens of employers from all sectors, including trusts. The provision of postcode data under GDPR is considered not to be sensitive. That doesn't mean that every organisation will interpret it in that way, but whenever we end up having a conversation direct with the data teams, governance teams at any organisation, we quickly get to a successful conclusion. So from our perspective, we're very happy to talk to any data teams just to reaffirm that we are literally just processing anonymous postcode data. But Barry, you've now undertaken this 14 times, so you must have got through this particular hurdle. Do you want to just say a couple of words about that?
Yeah, we did. I think historically there is always an issue, information governance, certainly with postcodes. We've had it in the past where my conversations with my colleagues in governance, why do you want the full postcode? What we did with Mobilityways is we had all the information from Mark about how it was going to be secure, and then we made sure that we got our governance involved. We did the full data privacy impact assessment, all of our justification for requiring that postcode data and what we were going to do with it. We supplied that to them, and then after that, they were happy. They were happy to sign off the assessment that we'd done, and happy for us to release the data. And yeah, it takes a bit of effort and that work from there, but we felt it was worth it to do that and to get the data fully across, rather than try and do a half measure. We've done half measures in the past, it hasn't worked, but there was no issue with the information that Mark was able to supply. Our governance were quite happy for us to use that data and share that data with them.
Thanks, Barry. Just moving on to a sort of theme around people. So 2 key questions here. One around, do both of you within your trusts have net zero leads to support green plans as per the delivering a net zero NHS report? So this is, I think, at board level.
Just speaking for the trust, we do have a bespoke sustainability team, and there's a green transport lead within there. So yes, I would say for Newcastle Trust that is the case.
I think for NCA, we're developing that. We have a sustainability committee. There's a lead within the exec at the moment for that, and they're taking the lead for that. We now have a group head of sustainability, and I'm now part of a larger sustainability team. So it's all coming in. So yeah, we've got that. We're moving towards that, but we may not exactly have it in the same definition.
Okay, brilliant, thank you. Right, I know we are on time. I'm going to do just one more area. I see there's questions still coming in, and I say we will respond to them all. There's a whole area around permits. So maybe if you might both speak for 1 minute on this, and I'll just give you the gist of what's come through. So one, which is an easy one, Elaine, can you share your permit criteria?
Okay. Well, in terms of assessment, in terms of eligibility for a permit, okay, well, what we do is that we have a loose scoring system. In terms of what we try to do is, the first thing that we do is that we look at somewhere lives. It's distance from home to base hospital, and then we look at availability of public transport. Then we look at specific shift patterns. Then we look at carer needs. And then within that, there is just countless other small areas to look at also. So what we do in the first instance is that we'll do that scoring set, and then you may end up with what in the first instance is a qualified score or a non-qualified score. And then there's other factors that come into play. So as I've mentioned before, it will be, yes, sometimes we have an outright qualification that we can absolutely assist with, and if there isn't, that's when our PTPs come into play, and we try to bring in another package to work with for the staff member.
And are you happy to share that sort of separately to this conversation with anyone that makes contact?
Oh yes, of course, yeah. No problem at all. Yeah.
Perfect.
Yeah. I think we use very similar. Yeah, we use very similar criteria to Elaine, Mark, and I think separately at the moment we're launching a new parking application system. We're trying to do it a little bit. We use the same thing with the cutoff score. We're trying to do something a little bit differently, but certainly if anybody needs the criteria, same with Elaine, just drop me, my contact details are there. Drop me an email. I'm happy to share our criteria as we do it, which is very similar to Elaine's, but also discuss how we're looking to do it with our new parking application system, if anybody needs any help with that.
Brilliant. I'm going to just stick with these permit ones and then finish. Elaine, how do you manage your staff having a 40 times a year permit? Do you use AMPR or is this manual enforcement?
It is a mixture of both, because we have a mixed site in terms of infrastructure and parking etc. So it is a mixture. It's partly manual, so you can imagine how onerous that is, and it is partly ANPR. And there's what we do is basically, if staff park in an area that we can just generate a monthly report, then that's fantastic. But we do have staff parking in areas where it is almost a mixture of, you know, almost not goodwill. We do obviously check, but staff do need to inform us when they're parking in these particular areas across the trust. But by and large, it's the NPO when we can.
Okay, brilliant. And just to flag, we're about to start quite a big pilot where we're linking our car sharing trip authentication with ANPR, so that the system knows that people have shared before they reach the barrier. When they reach the barrier, perhaps for a car sharing area, the barrier will open, or it could also be used to give people cheaper access to certain car parks too. So that's coming imminently. Do you offer, I guess this is for either of you, do you discount or do you offer priority for electric cars in terms of parking permits?
Well, from the trust, no, not at the moment, we don't. I think there's sometimes a lot of expectation from staff. They do tell us when they've purchased an electric vehicle, and they do tend to think that goes hand in hand with a car parking space, and there's disappointment there. But no, we don't prioritise as it stands. No.
No, we don't either at the for EVs. We don't record anything on there, and no, we've no plans to do so for the time being. It's not on our radar at the moment. Our key issue at the moment is trying to sort out charging points, but that's a totally different conversation and charging point strategy. We'll not go into that one now. Okay.
Right, I'm conscious we're 4 or 5 minutes over. I promised to keep to time. Can I thank the panelists? Thank Elaine particularly for stepping in at the last minute, and thank you, Barry. Thanks to Eva from our own team who put all this together, and most importantly, of course, thank you all for attending and for your questions, and we will come back to you with answers to all those questions that we haven't managed to cover off as soon as we can. So enjoy the rest of your day and your weekend, and thanks very much for joining us.